County Department of Public Health reports COVID cases are declining as monkeypox cases are on the rise. This, as the CDC admits, it's made some pretty big mistakes responding to COVID-19, including confusing public messaging. Phil Shuman will dive into that with some local reaction from local health officials, of course. Phil, we will get to you in just a moment. But first, more on those declining coronavirus numbers.
This is, what we were all hoping for, and we were hoping that the efforts we were all making all along would start to help us slow down transmissions.
That was, of course, LA County Health Director Barbara Ferrer responding to my question about what is behind the declining cases, noting that the declines are happening despite not reinstituting an indoor mask mandate. She says the drop in cases and hospitalizations is due to a collective effort from people who still choose to mask and businesses that require it. Cases are down 7% since last week. Hospitalizations dropped 9% over the last 7 days. Now, about monkeypox.
To date, there have been 971 cases of monkeypox identified in LA County, which is double the number of cases we had 2 weeks ago.
Dr. Muntu Davis there reporting the first monkeypox case of someone in a jail and the first case among someone experiencing homelessness. The county has received more than 43,000 vaccine doses, administered almost all of those. Also, the county just received a new shipment of almost 29,000 doses, but that's far below what the federal government had promised. The COVID pandemic and the current monkeypox outbreak have proven how we need accurate and timely messaging about threats to our well-being. And just yesterday, startling admission from the head of the CDC revealed the need to improve communication from the federal government. So what's being done to improve it locally? It is a question Phil Shuman's been looking into, and he joins us now live from a brand new monkeypox vaccination center in El Monte. Phil.
Well, that's right. You remember over the past couple of years, we've been talking about this on the Fox 11 News. So many basic questions. Do I need to wear a mask? When? Where? Who's in charge? Is it the mayor? Is it Barbara Ferrer? Is it the Board of Supervisors? Is it Governor Newsom? Is it the President? Is it Dr. Fauci, the CDC? Mixed messages. The idea is to condense that, be clear and concise, and get out accurate, fast information. Inside the El Monte Senior Center, the latest pop-up vaccine site for monkeypox, Arch Junger is one of the first ones here. How did you find out about this?
A friend of mine gave me the link, and I just went on the website and put in my information and just waited, and I got a text like the next day.
In addition to your own doctor, the LA County Public Health website, for now the only way to make an appointment. It lists risk factors, eligibility, clear and straightforward. Information hasn't always been that simple to find. In the past 2.5 years, COVID, between local government, counties, the state, the feds, Dr. Fauci, differing websites, guidelines, policies, risk levels, treatments. As the CDC director put it, confusing and overwhelming.
At CDC, we remain committed to providing the necessary guidance, education, and resources as we continue to respond.
Locally, Public Health's Barbara Ferrer says the department is doing their own review, looking at ways to improve.
I think we've all acknowledged all along we've made mistakes. So I don't think there's any surprises there. It's been a long duration event with lots of changing science.
What mistakes? She wouldn't say. But Matt Shoup of Praetorian Public Relations says it's wrong to blame mixed messaging on changing science.
We have an emerging, another pandemic with monkeypox. And so they don't have time to just say, yeah, we're going to workshop this and study this in the future. The change needs to happen now.
Shoup feels it's been more about changing political considerations, and that's wrong.
So your advice to those who disseminate information would be what?
Be quick, be responsive, be transparent, and admit fault when you're wrong and say you're going to fix it. People like honesty. They don't like hypocrites. They don't like liars.
So the idea is to make information easy to get without wading through pages and pages of data on a website. Of course, it helps if you have a phone or access to a computer. But in Los Angeles County, there is an 888 number for people to call. And Marla, just the fact that they only have one website to make an appointment for the monkeypox vaccine is already an improvement. You remember during the COVID vaccines, you could go to the county, you could go to the state. There was information from the feds. So everybody is focusing on the need to improve the information flow. When that LA County study will be done, what exactly they're looking at, who's doing it, we're still waiting for answers to those questions. Live in El Monte, I'm Phil Shuman, Fox 11 News.